Obamacare was introduced with the promise of affordable healthcare for all, but the reality has been far from the expectations. This presentation delves into the truth behind rising healthcare costs and the impact on families, businesses, and the American medical system. In 2009, promises were made to ensure affordable healthcare, allowing Americans to keep their doctors and plans. Fast forward to 2025, and the reality is starkly different. Premiums have skyrocketed, millions remain uninsured, and healthcare costs continue to spiral upwards, leaving working families struggling to pay the price. President Obama assured Americans they could keep their healthcare plans, but millions faced cancellations, displacement, and increased costs. The promise of, if you like your plan, you can keep it, turned out to be a significant lie, affecting families across the nation. The passage of Obamacare was one of the most contentious legislative processes in American history, marked by closed-door negotiations and a lack of bipartisan support. This slide outlines the timeline of how Obamacare was forced through Congress, highlighting key events and decisions. Obamacare's passage was marked by a party-line vote, with no Republican support. This lack of bipartisan agreement has contributed to the ongoing issues and challenges faced by the healthcare system under Obamacare. The Supreme Court's decision to classify the individual mandate as a tax was a pivotal moment for Obamacare. Despite initial promises, this decision has had significant implications for the healthcare law and its perception among the American public. The Affordable Care Act has ironically led to increased premiums, deductibles, and annual costs for families. This slide highlights the financial burden placed on Americans, contradicting the very name of the act. In the first year of Obamacare, premiums across various states saw a dramatic increase. This slide illustrates the financial impact on families, as they faced higher costs for their healthcare coverage. As costs mounted, major insurance companies began exiting Obamacare exchanges, leaving consumers with fewer choices and higher prices. This slide discusses the mass exodus and the resulting market failure, which left many Americans without adequate coverage options. Obamacare's promise of choice became a nightmare of restrictions, with narrow networks, doctor shortages, and geographic limits. Patients found themselves trapped in plans that didn't meet their needs, highlighting the reality of consumer protection under the law. Beyond the individual mandate, Obamacare imposed a web of hidden taxes that increased costs for families, seniors, and medical device manufacturers. This slide explores the various taxes and penalties that have made healthcare more expensive for everyone. Obamacare's employer mandate forced businesses to cut hours, reduce hiring, and shift full-time positions to avoid penalties. This slide examines the impact on workers and businesses, highlighting the challenges faced in maintaining affordable healthcare coverage. Small businesses have been devastated by Obamacare's costly mandates and complex regulations, leading to reduced growth and job losses. This slide discusses the economic impact on small businesses and the challenges they face in providing healthcare coverage. Obamacare attempted to force states into Medicaid expansion, creating constitutional crises and budget disasters. This slide outlines the battles faced by states, the Supreme Court's intervention, and the ongoing resistance to expansion. Obamacare's subsidy system has become a playground for fraud, waste, and abuse, with billions of taxpayer dollars squandered. This slide highlights the failures in income verification, phantom enrollees, and documentation scandals. While politicians celebrated subsidies, middle-class families who didn't qualify for government assistance were crushed by Obamacare's costs. This slide explores the financial burden faced by these families, who became the forgotten victims of healthcare reform. Obamacare's complexity and increased costs have led to a significant number of doctors leaving the profession. This slide illustrates the trend and its impact on the healthcare system, as experienced professionals exit the field. Rural America has been devastated by hospital closures and regulatory requirements under Obamacare. This slide discusses the impact on rural communities, where access to healthcare has become increasingly limited. Obamacare accelerated the corporate consolidation of American healthcare, creating monopolies that drive up costs and reduce quality. This slide explores the regulatory complexity and the impact on doctors, patients, and insurance giants. Obamacare relies heavily on taxpayer subsidies to mask its failures, with costs continuing to rise despite government support. This slide examines the financial burden placed on taxpayers and the unsustainable nature of the healthcare system under Obamacare. Using COVID as cover, Biden dramatically expanded Obamacare subsidies in 2021, creating temporary relief that masked the system's fundamental problems while adding hundreds of billions to the national debt. The Congressional Budget Office estimated these temporary enhancements would cost $34 billion over 2 years, money borrowed from future generations to prop up a failing system. Biden's subsidy expansion provided temporary political cover while making Obamacare's long-term sustainability crisis even worse. The enhanced subsidies created false enrollment numbers and deeper taxpayer dependency. This government addiction is a seed for creating temporary benefits that become permanent political entitlements, regardless of fiscal reality or policy effectiveness. The annual subsidies Biden created will soon end, leaving a looming crisis that will force Obamacare to sink or swim. Without the federal government increase in the budget, hard-hit families will face the expiration of these subsidies by January 2025, prompting a scramble for sustainable solutions. As the subsidy expiration approaches, Democrats are desperately scrambling to avoid political disaster. They are discovering that their healthcare success story was built on borrowed money and temporary fixes. Their desperation shows as they propose new spending measures without massive ongoing government intervention and spending. Facing the imminent collapse of their subsidy-dependent system, Democrats are already crafting their next big lie, blaming Republicans for Obamacare's failures when temporary subsidies expire. The American people deserve better than political blame games with their healthcare at stake. They deserve the truth about Obamacare's failures and real solutions for the future. The mainstream media has been complicit in covering up Obamacare's failures, spinning Democratic talking points while ignoring the real issues imposed on American families. Media accountability for these real-world impacts is crucial as we see the media's role in shaping public perception and political futures. Behind every Obamacare statistic are real American families who have been disrupted by government healthcare mandates. These are their stories, the human cost of political arrogance. Every story represents a family sacrificing other necessities, home repairs, children's education, retirement savings, to pay for government-mandated insurance they can't afford to use. Obamacare's unfettered grab over federal healthcare reform is about creating government dependency that would expand Democratic political power. The subsidy system is designed to be addictive and irreversible. The end goal is to engineer a healthcare complex to control our American freedom, reducing citizens to pawns in a political game. America can have better healthcare through market-based reforms that increase choice, reduce costs, and restore the doctor-patient relationship. The solution isn't more government, it's getting government out of the way. These same market mechanisms that give us affordable smartphones, computers, and cars can restore American healthcare, if government gets out of the way. Healthcare freedom means the right to choose your doctor, your insurance, and your treatment without government interference. It means competitive markets that serve patients, not politicians. The choice is ours. We can break the grip of government dependency and regulation, or we can restore the principles that made American healthcare the best in the world. SHR Media production provides in-depth analysis of government programs, policy failures, and their real-world impact on American families and businesses. Our mission is to cut through political spin and media bias to deliver facts that matter to your daily life and your future. Because Americans deserve the truth about their government's policies. This presentation contains factual analysis of the Affordable Care Act's implementation and impact from 2010-2025. Sources include government reports, academic studies, and documented real-world experiences of American families and healthcare providers. SHR Media production, exposing government failure, defending American freedom.